Okay, now before we start smallpox, what we're going to focus, because so many facts here, we focus into three things. Okay, first, the name of the virus and the type of the organism. Okay, so the name of the virus is Varroa virus. Are you clear? Varroa virus. Type of organism, virus. You don't tell me a Varroa virus is a bacteria, will kill you. Okay. Next, mode of transmission. So by airborne. Means that when the infected person sneezes out, cough out, airborne, then inhaled by the uninfected person, therefore the disease spread. So when you know it's airborne, where is the site of infection? Airborne, inhaled. So definitely will be the first site of infection will be respiratory tract, the trachea, lung. Okay, from there it spread to whole body. So the first site infection, we should know that because airborne, so therefore site infection is respiratory tract. Okay, so these two criteria you have to know for all diseases. You have to know what is the name of the pathogen, what is the kind of organism, what is the mode of transmissions, and where is site infection for all organisms, all diseases we are going to learn. Third one will be special for the particular disease. Smallpox, we are going to focus the success story of the vaccine. Okay, the success story of the vaccination. Okay, so smallpox is an acute contagious disease caused by Varroa virus. We have Varroa major and minor. Okay, so it depends on severity. Major will cause extensive rash and higher fever. Varroa minor will be less severe disease. So this is the structure of virus view under the TEM. So how it spread? It spread from a person to a person, okay, by infected aerosols, okay, or air droplets, airborne disease. In face-to-face contact with an infected person. It must from infected person. Always remember, from infected person to uninfected person. Okay. So it can be transmitted by contaminated clothes, the clothes and also the bedding. Okay. So sign and symptom of smallpox. This one is not for you guys. I mean, if you want to know more about smallpox, you can go through it. But what I want to show here is one of the success story about this vaccination, because the sign and symptom of smallpox is very, very obvious. Are you clear? A person with the smallpox, you can see, confirm this one is smallpox. It won't be other disease. So you will misdiagnose it. Very, very, very you can misdiagnose with this kind of features. So under this vaccination scheme for smallpox, in 1960s, okay, eradication complete the entire process in 1980s. So in 1960s, 1950s, that time, so smallpox actually killed a lot of people. Smallpox killed a lot of people. Smallpox at that time is claimed as the fatal disease. You won't be cured. When you get a smallpox, you wait to die. Are you clear? That kind of severity. So when the vaccination program started, they do this what we call the ring vaccination. Ring vaccination, basically, we're talking about one household. If there is a positive case of the smallpox, the 30 households surrounding this house will get the vaccine. So, if the disease is very obvious, people will know your household of people get the smallpox. You can report straight away, so that the healthcare personnel can come in and give the vaccination on the 30 households surrounding this household. Because the sign symptom is very, very obvious. If the sign symptom is not obvious, you won't be able to do this. Are you clear? Okay. So we go through the sign symptom of smallpox. A lot of medical term here, don't need to worry. As I said, that no question will ask you to write this. But generally, the virus is a Varroa major. Okay, so because it's the airborne, it will cause, the infections at the respiratory tract there. Okay, and then they spread to the regional lymph nodes. From there, they start to multiply. So initial growth phase of virus seems to move from the cell to cell, but around 12 days, then the lysis of the infected cells. So means that now virus can be spread into the blood. So the contaminations of the blood with the virus is called viremia. Okay, viremia basically means that the blood. Okay, mia here means blood. Okay, hypoglycemia. Hypoglycemia means, hypo means low, glycemia means, okay, gly means glucose. So it means that lack of glucose in your blood. Okay, so semia here means the blood, and you have the second wave of multiplication occur in the spleen, bone marrow start from the respiratory tract, spread to your spleen, bone marrow, lymph nodes, and so on. Okay, so the initial symptoms are quite similar to other virus infection. You have the fever, muscle pain, headaches. Okay. Then you had this pre-eruptive stage, will last about 2 to 4 days. By 12 to 15 days, you can see the lesions now. Okay, so this lesion rapidly enlarge and rupture, release large number of virus into the saliva. This is where they start to spread. Because the rupture in the saliva also means that airborne in your mouth. You cough out, you sneeze out, the virus start to spread. Are you clear? Okay. So smallpox virus prefer to attack the skin cells, cause the characteristic pimple called the maculae, so associated with the disease. Okay, so if you classify them, viral major infection can take several different causes, resulting in 4 types of smallpox disease based on the route classification. Ordinary modified are quite less severe. Malignant or hemorrhagic is the one that caused the fatal. So a lot of the fatal fatality is due to this hemorrhagic and malignant smallpox. Okay, but again, just to let you guys know about this smallpox. Okay, in general, if you're interested to know, please go through. Okay, please go through. That means this smallpox. What we concern more will be the eradication program. Okay, so feature smallpox, guys. Highlight. You need to know the name of pathogen. You need to know method of transmissions. You need to know site of actions or site of infection. These 3 only. Okay, the rest no need. So we have viral virus as the name of the pathogen. Method of transmissions, inhalation of airborne viral virus, cough out or sneeze out by the infected person. Some action, respiratory tract, and then is slightly spread to other organs through the circulation. Clinical feature, method of diagnosis for your information only. Okay, you can copy down. No, that doesn't matter. No, not important for this. Okay, no question will ask about this. But those terms, for example, PCR, RFLP, serological test, ELISA, those are the terms that in A2 you're going to see them again. Are you clear? Okay, so no worry about this. Highlight this part. Very important. The eradications of the smallpox. Why is eradication of smallpox by using this vaccination is so effective? Okay, and success. So in 1967, as in 1960s, so WHO started to launch the intensified plan to eradicate smallpox because smallpox killed too many people, particularly young kids. Are you clear? Okay, and a lot of time because of lesions, it developed the infection. Are you clear? Okay, you didn't take care of the wound, infection take place. And that time, you know, 1960, the healthcare services is not advanced. It's not like now. Okay, you have a good hospital, you got a private hospital, you got money, you go there, but you have to imagine the 1960s. Okay, it's very poor and it's not so advanced. So following successful campaign to achieve high level of immunization globally, the last case of endemically circulating smallpox occurred in 1977 and last known case in Somalia in 1977. So 1979 or 1980s, WHO actually declared that whole world free of, we already successfully eradicated the smallpox. So what is the success factor? And until now, none of the disease actually can be done. Are you clear? It's only 2 diseases. I can't recall another disease, but it's 1 out of 2 diseases that will manage to eradicate it through the vaccination programs. Okay? Clear? Any questions so far? Now, what is the success story here? Not story, but the factor. First, the varroa virus was stable. It's not like COVID. Last few months, we heard about Delta, and suddenly Omicron coming in. So your vaccination program, it may not be so effective. That's why the protections actually drop. And talk about Delta, they said about 80+, but Omicron now dropped to about 50 or 60. Can you see that? So again, the protection because antigenic, the change in the antigen due to the mutation. But varroa virus, they are stable. They don't change much of their antigen. So therefore, the same vaccine can be used. Okay, over and over again. Okay. Now, the vaccine also made from a harmless strain of a similar virus and was effective because it was a live vaccine. I always say that if the vaccine is a live vaccine, when I inject into a particular individual, it mimics a real infection because this live vaccine, the live microorganism, they multiply in our body. So 1 injection enough already. You don't need to get a booster. This is totally different from the measles. The MMR vaccine, measles, they use the dead virus. So when you use a dead virus, they won't mimic. So they need the booster. What's the problem with the booster? How to keep track is problem. Last time in 1960, how to keep track? Even now with the booster in Malaysia, for COVID, the booster injection for some of the categories actually very, very low. Can you see that? Okay. But if 1 shot settle, easier, no issues. Can you see that? Okay. The third, vaccine was freeze-dried and could be kept at higher temperature for as long as 6 months. This is very, very important. You have to imagine it's 1960s. Not every household will have refrigerator. Okay, the rural area. Okay, those countries very, very low in terms of the development. So how we keep this? And there's no electricity. So you cannot expect the WHO person carry this. Okay, refrigerator all the way. Okay, so therefore, this kind of vaccine is very, very good. You don't expect the things like COVID. Okay, the vaccine you have to store it at 8 degrees Celsius or -8 degrees Celsius. So this is really difficult. And very important here, infected person, okay, or individual, were easily to be identified. So when a case of smallpox was reported, everyone in the household and 30 surrounding household as well as other relatives and possible contacts will be vaccinated. Are you clear? And you have to understand that in 1960, the mobility is not, okay, mobility is not as great as us now. And most they just within their own village, their own kampong region. Can you see that? They won't migrate from, one region and then they move within a short period of time. So therefore, vaccination is okay. Spreading also will be low. Can you see that? Are you clear? So, how to administer the vaccine? This will be quite a surprise. You may be surprised because previously the administration of the vaccine is very difficult because there's no needle for delivery of the vaccine. You were surprised that reusable needles some more. How about HIV infection? Okay, so please bear in mind 1960 there's no HIV infections. Yeah, HIV infections start in 1980s. Are you clear? HIV infection, but the steroid, reusable, this steroids. Okay, this needle. Okay, so basically the vaccination needle that we use, or the needle that we use for the injections, actually quite new. This thing is not very, very old because in 1960s, we still use a reusable one. I will show you guys how it looks like. And smallpox virus did not linger in the body after the infections. Like for example, you compare the HIV. The dormant, you don't know, but you can spread the virus. But measles, within 12 to 13 days, 14 days, you can see the symptom already. Immediately you can detect. Okay? And the virus did not infect animal. This is very important. If infect animal, for example, you try to imagine dengue. You want to vaccinate human, but still got the insect. How are you going to vaccinate insect? Impossible to vaccinate them. Okay? And last, many 60 to 70 years old become enthusiastic vaccinator and supply the information about the cases. When they didn't know, they straight away report. So therefore, you can see that the whole program is quite and very, very successful. And at that time also, we don't have anti-vaxxer. Right? The problem of this human right and so on. Are you clear? So therefore, the eradication program is very, very successful. And as I said, that this is the needle actually. How it is used? Can you see that the needle, the forks here actually will have the solution that contain the vaccine, and they poke like this. Are you clear? Can I see that? Without this needle, it's very hard to, okay, to inject. So eradication of the smallpox successful and difficult to repeat this success until now, right? Due to the political stability of the country, poor infrastructures, and public health facility, and with few trained personnel. So nowadays, it's very, very difficult to actually eradicate the one of the disease because high mobility. As I said, that when the mobility is high, today I say that I can in Malaysia, the next day I can in Singapore, or not only next day, the next hour I can be in Singapore, right? Okay, if I have a private jet, I can go to anywhere. So that is how we can actually spread the virus. Okay, so with this I've done for today, and tomorrow we continue with the measles and other diseases. Okay.